हर रोज हर दिन हम बहुत सारे स्ट्रेस से गुजरते हैं, बहुत सारे ऐसे वर्कलोड, स्टडी प्रेशर, सारा कुछ होता है जिससे कि हम परेशान हो जाते हैं और समझ नहीं आता हम क्या करें। बट ये दिल को थोड़ा सा प्रॉब्लम हो जाता है उससे। आपका खान पीन, आपका लाइफस्टाइल बहुत इम्पैक्ट करता है। तो आज डॉक्टर जैन से जानेंगे कि हाउ वी कैन लिव अ हेल्दी एंड अ हार्टी लाइफ। Dr. Jay, thank you and welcome to our session. We would like to explore with you and know what are some of the common causes of heart attack.
Yeah, so good evening, everyone. First of all, sorry for the delay. Actually, there are so many factors, multiple factors, which contribute to the heart diseases, right? First, foremost, if you have a hypertension, diabetes, and cholesterol, dyslipidemia, right? You should be diagnosed early. You should be treated. You should modify your lifestyle according whichever disease you have, like hypertension, diabetes, and dyslipidemia. Then fourth is bad habits. Like if you have any kind of tobacco consumption or alcohol, you should avoid that. You should not take stress. Fifth foremost, and sixth is good amount of sleep or good amount of lifestyle, good lifestyle, like healthy lifestyle. If you say that, you have to maintain a scheduled routine, like if you do exercise, yoga, walking, cardio, if you take a meal, that has to be at a proper timing, proper meal, and you have to take a proper rest also, right? So these are the 5 6 common things which helps. If you can control all these things, then that will help your heart health also.
Doctor, we've seen that when our cholesterol levels are disbalanced, the LDL levels, especially if they go high, तो हमने देखा है कि people, they say that they are at a higher risk of heart attack and heart diseases. How true is that, and how can we monitor our cholesterol levels?
See, generally, when a patient comes with a heart disease or heart problem or heart attack, we generally check for LDL levels, right? So that is most important marker for heart disease evaluation, right? But not only LDL, there are total cholesterol levels, triglycerides levels. Those are also important factor. If you have a low HDL levels, HDL is a good cholesterol. If you have a low level of HDL, that also contributes to atherosclerosis, which we call that plaque progression. There are blockage buildup in your arteries, not only heart arteries, in all over body, whichever arteries. If there is a plaque buildup, if there is a blockage, if there is atherosclerosis progression, right, that happens because of high levels of LDL, high levels of total cholesterol or triglycerides, and low levels of HDL, right? So this is major marker for to evaluate the patient is having a atherosclerosis disease or not, right? If patient is having a good LDL control, but he is also having a low HDL, that is also contributing to some problems, right? So HDL, good levels of HDL, it is almost around 45, 50, 60, which are good HDL levels, right? In
Okay.
vegetarian patients, that is very difficult to achieve those goals, right? But they have to take some medication also if HDL is less than 20, right? And LDL, you can control your LDL level with diet or with medicine. Okay, there are multiple newer drugs are also available in the market right now. So that some patients are also come with a familial hypercholesterolemia, right? In familial hypercholesterolemia, it is very hard to treat with single medicine or lifestyle modification. But in those patients also, it is highly treatable medicines are available, which we can treat. Even some patient we come with LDL of 700, 800, right? So those are the
Oh,
cases of familial hypercholesterolemia, right? So they said that he's on medication since 5 years, it is not treated, but that's not true. Newer drugs, medicine which are available in the market, you should consult your cardiologist. They will prescribe you, and that will definitely control your cholesterol levels.
डॉक्टर जब भी मतलब आई हैव विजिटेड अ कार्डियोलॉजिस्ट, जैसे कि अपना बीपी कंट्रोल रखो, ब्लड प्रेशर चेक कराओ, एंड डॉक्टर्स जनरल फिजिशियंस भी यही बोलते हैं कि अपना बीपी कंट्रोल रखो. व्हाई इज इट सो? हाउ डू बीपी, हाई ब्लड प्रेशर, इम्पैक्ट आवर हार्ट?
See, whatever the I would say that BP should be controlled, yes, definitely, but BP should be regulated. It should be at certain limit, right? If it is 110 at one day, and on a second day, if it is going 160, 180, so this much of fluctuation in your BP that damages your arteries more. Okay, that damages the stress level, oxidative stress level. There are some oxidative free radicals are in the body blood vessels circulating, so that will create damage to your blood vessels. Okay, so fluctuation in the BP would be more harmful than the BP itself. Yes, it has to be treated if it is more than 140 systolic BP, if it is more than 140 diastolic BP, if it is 80 or 90 more than that, then you should control it with lifestyle modification. First, I would not prescribe medicine. First, everybody has to be modified their lifestyle, their habits, their food habits, their complete lifestyle makeover. Okay, do it for 3 months very consciously and obediently. And if still the BP is not controlled, then continue, start with the medication. So
तो
BP is
यही से हम
definitely.
जानना चाहेंगे हमारे ऑडियंस से कि हाउ मेनी ऑफ यू नो व्हाट इज द नॉर्मल बीपी. प्लीज पुट इन द चैट बॉक्स कि नॉर्मली बीपी कितना होना चाहिए. तो
So,
डॉक्टर, यस, यू वर सेइंग
yeah,
समथिंग.
it is not the number which is uh, defined. It's a normal BP. It's a range, right? So systolic BP, which we call upper limit of BP, right? That is 120 to 130. Initially, 4 years back, it was 140. 140 should be normal, but newer guidelines suggest that it has to be below 130. Okay, so 120 to 130 above the systolic BP, and the diastolic BP that has to be in between 70 to 80. That is normal range. Okay, if it is going above 140, if diastolic BP is going above 80 or 90, then it should be alarming that you should modify your lifestyle. And with lifestyle, generally, whatever young patients are measuring BP and they found that he's having a BP of 150 by 90. Okay, do not panic. Panic, anxiety, stress, all this create more BP raised rather than controlling. So do not panic. Just think about it. What wrong with your body? What wrong you are doing with your body? Just think about it. Do the lifestyle changes. And in 90% of cases in young patients who found only once a BP is elevated, once or twice BP is elevated, they can control with lifestyle in within 15 days or month. Okay, so they don't have to start the medication. Okay, so they can control with their lifestyle only. Okay, and don't measure that once in a week, twice, thrice in a week, the BP is more than this, and you get panic, and the BP will not fall down then. If you get
Yeah.
panic, oh my God, I found a BP of 170, oh my God, what happened to me? Just relax. Why it is 170? You didn't take a proper sleep, you didn't take a proper diet, you had a good food, you had a proper sleep or not, are you stressed of something? Just think about those other factors why your BP is elevated, then work on those factors and the BP will fall down normally.
एक क्वेश्चन आया है डॉक्टर. सर, कैन यू टेल मी इफ बीपी और शुगर बोथ आर हाई इन लेवल, व्हाट कैन आई डू? कैन यू प्लीज सजेस्ट समथिंग फॉर हर?
See, both are very dangerous thing which will lead your body to a bad cardiac health, and gradually all organs will damage, right? So both has to be controlled with lifestyle modification, and if it is not helping you, then you should continue medication regularly. Some people tell us that I am taking this allopathic medication since long, can I take this medication also, can I take this? You want to take other medication and you want to try it out for your BP and diabetes control, you can try it out. But please don't stop allopathic medication, because those are clinically proven, tried and tested research medication. We have data of it that how these drugs will help you, how this drug affects, and how they control the BP and diabetes. Okay, so you have to continue those medication, and then On top of it, whatever remedy you want to use, you can use it. We don't mind it, right?
So there are a few questions that our audience they have shared. Why do heart palpitations happen? What are the causes behind it? Dr. Yao. Yeah.
Yeah, it's because of so many conditions that if patient is anxiety, then again palpitation happens. If patient is having adrenaline rush, if he's going to do some great work, aggressive work, if he's walking, he's a runner, then also the palpitation occurs. So those are the physiological causes of palpitation. Okay, your body adjusts with your high levels of adrenaline and low levels of adrenaline. Okay, so your body improves the heart rate and lowers the heart rate. And if it improves the heart rate, the cardiac output and the blood supply to the body improves. Okay, if you are taking rest, your heart subsides, your rate subsides, the blood levels, the blood circulation falls down, and you feel relaxed. Okay, so those are the physiological phenomena. The palpitation happens. Other than that, it's if you are panic, if you are anxiety, if you have a phobia, if you have a car accident, okay, so those are the things that time palpitation happens. That is generally it is normal. In some patients, it is inborn palpitation also, which we called in a cardiology, the term is AVRT, AVNRT, right? Those are the electrological conditions. The heart functions with a electrophysiological, it's a circuit. Basically,
Oh,
your heart pumps,
okay.
that is a inborn circuit. Okay. So in some cases, like the patient have circuit problem, we call it in a layman language, right? That if you turn on the switch, the current goes and the lights or fan switches on, right? So same, there are two switches in your heart. One, if you turn it on, the current passes to the second switch. The second switch that will turn on, and it will help the heart to pump. In some
Okay.
cases, this there are multiple switches, and at some situation, those switches get activated. Okay, so the heart rate gets double. If you have a normal of 60 heart rate, if the two of that switch get activated, it becomes 128 per minute. Okay, so those are the condition that has to be evaluated, but 70-80% of cases it's a physiological palpitations.
So, like आपने जैसे सब अभी explain किया, our body is also like a machine. जैसे body में भी the way you said like switches and all, our body acts also like a machine and machine को जिस तरह से care की जरूरत है, हमारी body को भी उसी तरह से care की जरूरत है. So there are a few other
Correct.
questions. एक question आया है, can smoking affect my heart in any way? Obviously, we've heard smoking is injurious, and अभी हमने discuss भी किया how our body needs care because it's just like a machine. तो हम
Yes.
जो भी स्मोक करते हैं, sedentary lifestyle है, how does that impact the heart?
See, in any sedentary lifestyle, bad habit consumption, stress, all this increases free radicals in the circulation. Okay, so those are the toxic metabolites. Okay, like nicotine, tar, whatever we heard the normal words, right? Those are the toxic substance that circulates in the arteries. Okay, so whenever the toxic substance, oxygen free radicals, right, they circulate in the arteries, it will damage the inner intimal layer of the arteries. Okay, so it's not only the heart artery, it can be kidneys artery, it can be pulmonary aortic, the main arteries, lower limb artery or upper limb, okay, that can be damaged. And in that damage, your cholesterol or any kind of blood clot gets stuck over there, it gets built up over there, and it's create a problem. Okay, so heart vessels are tiny vessels. So in that, if that inner layer of your arteries gets damaged, it's very easy that a clot or a cholesterol buildup will happen there, and over the time you will have a heart attack. Okay, so that is the condition of heart. How the heart attack how happens, how the clot builds up over there. There has to be some damage. Okay, it is not like in a normal vessel, the clot buildup. Okay, there has to be damage in the inner layer of the artery, and then the clot gets built up over there, and over the time it create a problem and blockage.
So, doctor, you come across many patients. Abhi, I think I just heard that you were operating only before joining this session. So, आप तो ऐसे बहुत सारे patients को deal करते हो. So, what are the symptoms that you see in them, or can you tell us the story of a patient who had been neglecting his health, and how did you operate, or something, some story that our audience can be motivated.
Yeah.
कहानी जानना चाहेंगे हम आपके कुछ patients की.
So majority of I about the symptoms, I don't have exactly this detailed experience, but I would say that majority of young patients, they believe that they have a heart attack, they have a acidity. They don't want to accept they have a heart attack. I have operated a case of 16-year-old male with a heart attack. His friends brought to me, and luckily his friend brought to me, and they said, "Okay, he is having a pain and gas acidity. He just doesn't want to play with us, and he's just faking the symptoms actually." When I saw the ECG, the patient was not faking the symptoms. He is having the symptoms. ECG shows he is having an acute attack, heart attack. So patient was correct, and by luck that his friends brought to the ER, and we got him treated. We put a stent also in his artery. One of his main artery is 100% blocked. Okay, so he's having symptoms, was like everybody around him was like he's faking. He has nothing. Just forget, right? But never ever doubt, even though you are 99% sure that you have acidity, gas, or anything. The current problems we face, that please go at nearest hospital, get an ECG done. If your ECG is normal, then yes, do not worry. You treat it as a acidity and routinely. Okay. So do not misguided your symptoms, that is it heart or gas or some other issues. Okay. A heart pain will generally, what we have seen, that whenever a heart attack pain occurs, a patient who have not gone to hospital since 50 years, he will reach to hospital. That pain is so severe. Okay. But not in all the cases the pain is so severe in diabetic patients. In some patients who have a good pain tolerance, in those patients, they don't worry about pain. They neglect those pain like it's something muscular, it's some neck ache. I have slept last night like this, and my backache is paining. So every possible symptom can correlate with heart attack. Okay, it's not like heart attack pain will happen at left side only. It's not like that. It can radiate to left shoulder, right shoulder. It can radiate to all of your upper back. It can radiate to jawline over here. It can give you a pain of like somebody strangulating your neck. It can give you pain like that also. It may your if your there are three main arteries in the heart which supplies the heart. If you have a block, if you have a blockage in right sided artery, okay, then you might not have chest pain, but you will have nausea and vomiting. Okay, so it's a typical kind of that, doctor, I have eaten outside in the morning, so I think I thought I am having a vomiting. But it can be food poisoning, food related, but it can be heart related also. Okay, so any of
How
symptoms.
frequently should somebody get their cholesterol levels checked? How frequent should that be? But हम तो neglect करते रहते हैं. हम तो like I am fit and fine, I'm healthy, so I won't go and get myself tested. How
So
frequently should
if
that be done?
I would say in my current practice, I offer that if you are below 45, then I would say that every 6 months or 1 year you get it tested, your routine test, and you just get your tested whole body checkup every yearly. Okay. And if you are above 45, or if you have already hypertension, diabetes, you have a stress related job or everything, then you get it tested every 3 to 6 months.
Hmm. So there is one more question. We will. There is a person who says that he has this tenacity. He's written that he's whenever there is a question asked or there's a situation in the house, he starts screaming. He cannot answer very soft in a calm manner. He reacts. So does that also impact the heart, or there are certain changes in the body that leads to such a reaction? क्या ऐसा
Yes,
कुछ reason भी है?
those are the personality behavior changes, right? Those are the personality disorders. There are different types of personalities around us. Okay. So yes, those kind of personality are more of a chances of having a heart disease. Okay. Cause the basically stress, it relates to stress and anxiety. Okay. Those kind of personality. And some of the kind of personality, they are very happy go lucky type of people. Okay. They even though they have a some problem or anything, they take it very lightly, very normally. So those type of personality will help your overall well-being also. Yes.
So people who come with a family history of heart attacks, are they at a higher risk of being prone to such a condition, heart attacks?
Yes, whoever genes play a major role in all of the disease. We
Hmm.
diagnose, we treat those things, but yeah, genetic factors, uh, it means a lot, right? So whoever has a strong family history in his mother or father side, anywhere, if they have a
Hmm.
young heart disease, young patients who had undergone angioplasty or bypass, they are at higher risk of having a heart disease. They are also should be, even though they don't have any symptom, they should be tested, checked for their heart health every yearly at least. Okay. And if every yearly they don't found anything, then they can prolong it to every 3 years. But whoever has a strong family history, they should
Hmm.
be tested regularly. They should consult their doctor regularly.
So, doctor, we have also seen that many people, like you said, gastric, acidity, these young, fit individuals, they sometimes feel that no, there's nothing to worry, and they go to the pharmacist and over the counter कुछ भी medicine लेके आ जाते हैं and वो खा लेते हैं. Can doing that lead to a heart risk?
No, doing that, if they have a acidity, it will get subsided. The
Hmm.
antacids can prescribe, people have in pocket, everybody nowadays, right? So antacid will help them. If they are actually having a acidity, it will be treated, okay, by the pharmacist. But if mm, you are seeing like out of 199 patient is having a acidity, but what about that one patient? That one patient we see in the news, okay, that this patient died doing this patient did not reach the hospital, but majority of patients are taking antacids directly over the counter and they take it, majority get treated also. But what about that 1% of patient, okay, who has a heart attack, but who thought or other people thought it's a acidity, just take this thing and take it lightly. Okay. So we are worried about those 1% of people. We don't worry about those 99 who's having a acidity and taken the treatment. Okay. But those, so that is why we prescribe whoever feels the same kind of symptoms, just get yourself treated, tested in nearest hospital. I just don't want you to do multiple tests and spend your money, but just get an ECG done. Okay,
So,
simplest test is
doctor,
ECG.
doctor, what are some of the blood tests that can be done? Like regular blood tests that can be done so that one knows how healthy their heart is.
So once we talk about that familial thingy right now, right? Familial risk of
Hmm.
heart disease. Those are there are newer tests. I call it, it's a homocystinemia, serum homocysteine levels, lipoprotein little a levels, lipid profiles. Those are the markers who have a family history of heart disease.